Welcome to another episode of Marketing Tips for Doctors. I'm your host, Dr. Barbara Hales, and today we have with us Dr. Safoora Zaka. Dr. Safoora Zaka is a board-certified internal medicine and obesity medicine physician, including palliative care and hospice. She brings a compelling story of leadership and passion. After years as a hospital-based physician and hospice medical director, she took a bold leap to build her own thriving medical aesthetics practice. She is a founder and CEO of Medical Aesthetics in Laser in Walnut Creek, California. Dr. Zaka is also a faculty member and a trainer for Allergan Medical Institute. She blends her medical expertise with entrepreneurial insight, empowering others to pursue purpose-driven careers in the medical field. Her journey offers valuable lessons on courage, balance, and following one's passion to create meaningful impact. Welcome to the show.
Thank you so much. Thanks for having me.
Oh, it's my pleasure. Tell me, first of all, how did you choose to become a hospitalist starting off?
So, I think being a doctor was just something that growing up, I've never thought of any other profession than being a doctor. My father was a physician. Both my brothers are physicians, and that's all I saw growing up. Medicine, that's all we talked about. Dinner table, lunch. That's all the conversations were,
And your
and
mother?
my mom was a housewife. She was not. She didn't have any.
Oh, she was holding it all together.
She was holding it all together. You're right. So yeah. So there was no other option. Everybody had to be a doctor. So yes, that was my childhood dream, and I did my med school in Pakistan, and that's after I came here and finished my study in in America and
But why a hospitalist?
started working. Started working. Why hospitalist? I think it's the action. I just loved I loved being in the hospital. I loved um, to take care of people who actually and be the first line of defense. I used to be in ER as a hospitalist, receiving patient, kind of taking care of them right when they arrive, and um, even in the hospital, I have done my rotations in ICU and taking care of critical patients, and I think I I find it more satisfying when I'm taking care of a critically ill patient, talking to family, just interacting with them. And I think that's where my comfort level was, and that's where I felt that I'm being useful, I'm being helpful to others.
So you love the action and you love
I love the
getting out.
action, yes.
So how did it come to be from loving the action that you could step away from it to go into aesthetics?
Yeah, the transition from hospital medicine to aesthetics was a little bit challenging because it's an entirely different mindset. You have to change your mindset because you're dealing with in hospital medicine you're actually dealing with, managing disease. In aesthetics, you're pretty much enhancing the well-being, the enhancing the confidence of people, and your language changes um, from medical language, clinical language, to more of a beauty and lifestyle language. So it was a it was a challenging transition, but I was ready for it because this was something later in my life I got passionate about, and I wanted to pursue my passion.
Well, that's wonderful. And you worked with somebody else before in aesthetics before you opened your own practice?
Yeah, I worked with somebody else briefly. It was a spa, and it and I just pretty much injected for them. It was not the ideal atmosphere for me. I think because I always believe that when we are injecting people, we are still performing procedure, and it's a medical procedure. So I take it very seriously. So I did not feel comfortable, but however, I think that kind of got me into the business, and that kind of gave me some confidence that I can do it on my own. I think within a few months, I just opened my own
Yeah.
practice.
Well, I think that that was really very helpful because it enabled you to see, like how the business worked,
Yes,
in
yes.
all of its intricacies. I think to open your own aesthetics, like spa, straight from being a hospitalist would be a bit extreme.
That's absolutely right. You're correct. Yes.
So now you decided, you know, I'm in it by myself. I'm
Mhm.
starting my own business. How did you start your own business? It must have been very challenging.
Yes, it's definitely it was challenging. As I said, the mindset change. That's something that you have to overcome the mindset. The language changes. Um, you're looking at it, the power brand is when patient comes. You have to focus on your branding, which I was actually with as hospital medicine. I was doing with Kaiser Permanente. I didn't have to worry about. Um,
It was not
branding myself. Yeah, right.
and people came to go to
People
Kaiser
came and
Permanente
people,
and they got you. So
yes,
yeah,
yes.
so
So I,
just learning about branding must have been a bit of a challenge.
it was a challenge, and I will be honest that I did not have a mentor at that time. I pretty much did it on my own. Definitely, I had my husband not by my side, so branding was different, a difficult task. Understanding the business aspect of it.
Hmm.
So, as a physician, you don't really know how business runs, right? So, we have to understand how the business side of it works. Also, you have to master the patient experience.
Hmm.
Um, that's just the little details in aesthetic medicine. Bedside manner is the brand power. So you really have to be you have to be you have to be really nice to the patient, number one, which you as a physician you are always a professional, but at the same time you want to make sure little details do matter, from how you make them feel. So people come to you for your name, but after that they'll continue coming to you based on how you made them feel. And
Hmm.
it's very important. And Of course, then social media comes as a part of business as well. You have to put yourself out there. Um, you definitely want to start slow. You want to find your niche. You want to find your audience. Um, uh,
So who would
you
you
know,
say your audience is?
so my audience is actually, the static population is getting younger and younger now, right? All the, our the new generation, the Gen Z, they are really into their looks. They definitely want to look natural. They want to do something called preventative aesthetics.
Hmm.
So definitely my patient population is getting younger, starting from 20s all the way. I have patients who are 80 actually. Not too many of them, but I've seen a lot of, I've a few that I can think of right now, are in their late 70s and early 80s.
So
So,
did you ever have a conflict seeing a
mhm,
person that, basically looked fine,
mhm,
saying that, they wanted to have additional work done? And was
mhm.
it conflict for you saying, well, we could do this, and in your mind thinking, there's absolutely nothing wrong with you. Why are you even here? I mean, was that a conflict?
Honestly, this is one thing that you learn from experience too, saying no. So saying no is very hard. sometimes, and now it's getting easier for me with experience. When you
So you'll,
really
you'll
need,
say so you'll say no to somebody. There's nothing wrong with you.
no, saying no to somebody when they don't need a treatment.
Right.
So, because what I do here is I make small little changes, keeping in mind their natural look,
Mm-hmm.
and we definitely do not. And uh, main thing that I have in mind as a physician, as an injector, is patient safety. Right?
Mm-hmm.
If let's say somebody does fillers and they love the look, they want to keep doing it. Number one uh, thing that I am thinking while I'm injecting that person is, okay, is this safe for that patient?
Mm-hmm.
And um, so safety comes first, and then of course the look. They are representing me as well, my works, right? So if this is the time to stop, I'm gonna tell them, you know what, your lips just look fine. You look beautiful, and this is the time you stop and take a little break, and you don't need to proceed with that. Yeah, so I think it gets easier with experience to say no to people when they don't need a procedure.
Would you say that you're artistic?
Oh, yeah, definitely. I take pride in that. I think aesthetic medicine is, you have to have that artistic eye. And I realized it, after I had finished my residency and started working as an hospitalist. That's when I slowly, one of my friends opened a med spa, and she is the one who, she was, I would not say she was an artistic, but she always asked me, okay, can you come and just help me out with that patient? And I did in it between hospital medicine, and I was helping her out. And that's when I realized that I do have that aesthetic eye. I can
Mhm.
see and I can understand what my patient is saying. So it's very important, not just you seeing something,
Mhm.
it's your patient seeing that too. So sometimes we can recommend a lot of things to people, but that's not their concern. That's not what they're looking at. So
Sure.
you really need to be skillful in hearing what your patient is saying, and of course, make your own recommendation as well.
So
That's
what is it?
safe
What
for the
is,
patient.
yeah. So what is the name of your spa?
My name of my spa is Medical Aesthetics and Laser.
Oh, that's probably, by the way, uh, what
Uh-huh.
the spell check was. It was probably laser. I don't know how.
Ah, I see. Okay, okay.
Yeah.
At least we figured it out, huh?
Yeah. Okay. So, you mentioned also that you're certified in obesity medicine. Do you deal
Mm-hmm.
with that in your aesthetic spa?
So I'm incorporating that into my practice now a lot more than what I did in the past for the last couple of years. We offer here body scans, some vitamin injections, and just to support with the diet. Um, and I'm still not, and I have you know, um, I work with another physician through telehealth, and we kind of uh, do the prescription through her, and patients come here, and then I pretty much take over with their management as well,
Yeah.
alongside with her.
Do you do surgery for barometric procedures?
No, that's I'm not a surgeon, so that's not something it's
Mhm.
in my scope of medicine.
Okay, so you've opened up your business, and I presume you really didn't have many patients when you opened the door. So,
Yes.
so how did you get your patients? What did you do to market yourself?
Yeah, first thing I would say is when you are starting a new business, you gotta start slow. You can't just put everything out there. So the way I started, um, I rented a small space, and I was still working with with Kaiser as a part-time physician.
Mhm.
So there is still a support to so I can support my business.
Yeah, so there was no
And
real uh, problem of fear that you're not going to be able to support yourself.
Yes, yes. And of course, my husband was always by my side and he was there to support me as well, even if I had not done Kaiser. I was at that time working with a hospice facility as working as a hospice medical director. And I did that as well. So at one point, I was actually doing three jobs. But just so that I can support my business, I was working weekends as well. So the way you market yourself is you got to put yourself on Google, have create a nice, spend some money on the website, create a nice user-friendly website. Google was there. I got into the social media part of it is a little bit late, yeah, a couple of years after my aesthetic when I opened the business. I think that really helped me a lot. So social media is, I think it's just something. It's not something I love to do, but I do it because a lot of people go there, see my before afters, um, and that helps me a lot bringing the clients. And I kind of it gives them a little bit of peace of mind that they're going
Sure.
to somebody who's not somebody new, and she has done procedures. I post a lot of before after pictures, so people are able to see my work.
Before and afters are really important. It's
Yeah, and
people love
that's
seeing like what was and what is now.
absolutely, yeah. And that's something that you have to work on as well. So initially, when you open your practice, focus on patient satisfaction, number one. Number two, building your portfolio before, after, kind of filming the procedure. It kind of humanize the whole process, right? You don't want to be behind the scene all the time. You wanna show your face so people can relate to you.
Yeah, absolutely. Um, as a spa, are you obligated to use EHR, or that really hasn't come your way?
Yeah, so there are a lot of you know there are a lot of EMR out there for aesthetic practices as
Oh, good.
well.
Mhm.
Jane is one of them. Boulevard is one of them. So I use Boulevard in my practice. Part of it I still do paper pencil as well. But yeah, Boulevard is the main system that I use in my practice. But I started with just paper charting.
Do you use networking in some way?
I did a lot of, I mean, I try to do a lot of networking, especially the local businesses as well. Initially I was, talking to different hair spas, hair salons, and just kind of putting name out there. Um, I even had some discount program for the first few of the hairdressers or hair, you know, um,
Salon.
what do you call it, salon that the girls who used to come to me.
Yeah.
So yeah, the few things I've done in the beginning when I was starting out. Um, yeah, and all those things help. They kind of put your name out there, and then word of mouth is big in my practice, which I, um, take pride in because that is the real review. That somebody comes to you, likes the job that you did, and then she goes and tells her friends.
Yeah, of course. Which social media platform do you find most helpful?
So for me, I would say Instagram and number two, TikTok.
Hmm.
Yeah, Instagram has helped me quite a bit. TikTok. I am on YouTube. I have a YouTube channel as well. But definitely the two main ones are that people see me mostly on Instagram and then number two, TikTok.
Um, what else do you do for marketing besides
Uh,
social media?
Besides social media, the SEO, the Google. I have a Google business page. I do Facebook as well. I forgot to mention that in there. Um, I am on Yelp as well. Of course, people do go in on Yelp as well just to see how the reviews. Um, and And just the local kind of talking to business people, I mean local businesses.
Mhm.
I have done on the gyms as well, you know how they run the ads. I have done that in the past. I have done Diablo magazine. I was on there for a few months as well. Um, and that was a great experience. I loved it. Um, yeah, these are the things I kind of did it over time.
Sure.
But yeah, right now just social media and Google is
Mhm.
my main
Yeah, I mean
marketing.
that's very helpful.
Yeah.
So that's great. Now, if one of our listeners is out there and they're a little burned out from the
Mhm.
type of medical practice that they have, and they want
Mhm.
to transition into something else, what is one tip that you would give them, or two tips?
So one tip or two tip, yeah. um, I think again, don't think that as if you are burnt out from your existing medical profession, this is going to be any easy. There will be a lot of challenges, but don't do it for the burnout part. Do it because you love the profession, you like it, you are passionate about aesthetics. Um, that should be your reason to pursue this career. If you are not passionate and you are just doing it to have a easy lifestyle, I don't think it's an. I mean, I'm not gonna say um, it is easier than hospital medicine. However, there are challenges opening your own practice. So do it for the passion, do it for the love, and you'll do great.
Okay, well, I think that you have said everything there is to say, and unless there's something else that you would like to mention.
No, I really want to thank you. Thanks for your time, and I really appreciate you reaching out. And
And how might people reach you?
people can reach me on Instagram. They can reach me on TikTok. I am a doctor. My handle is Dr. Safoora Zaka on Instagram. Same for TikTok. And my website is drzaka.com.
Of course,
They
those will
can,
all be in the show notes. So you
yeah,
have to try to figure out how to spell your name because
exactly, Zaka. But yeah, it's very simple name.
it will be in the show notes. Uh,
Okay, great.
so anyway, it was a pleasure having you today. This has been another episode of Marketing Tips for Doctors. Till next time.